In the age of digital transformation, nearly all aspects of our lives become smarter. From how we shop, to how we travel, from how to manage finance, to how we communicate. But what about healthcare? How do we make medical care not only smarter, but more safer, faster, and more accessible?
Singapore has built one of the world's most connected healthcare systems through innovations like National Electronic Health Record. Another key piece is telehealth. Through remote consultations, mobile health apps, and monitoring tools, patients in Singapore can now access care from home, a system that became essential during COVID-19. But while Kazakhstan is making efforts to modernize, major hurdles remain. Health data is fragmented, software is incompatible, and most patients still don't have access to their own records. In this video, we explore what Kazakhstan can learn from Singapore's smart healthcare ecosystem, focusing on Health Hub, telehealth, and the NEHR.
And I guess one of the biggest challenge that I have is the harmonization of the information. How can we bring it in the standard formats? Because hospital operation, they will want it to be very efficient. But if we want them to adhere to a certain standards, to put in the data, they may see it as an additional healthcare burden into their workload itself. We have to mitigate that. And the change management will be the key things how we can improve the whole system.
In addition to NEHR, telehealth has become a key component of Singapore's strategy to deliver smarter care. Through services such as remote consultations, telemonitoring, and mobile health apps, patients can access care from the comfort of their homes, an approach that became particularly vital during the COVID-19 pandemic. Singapore's telehealth guidelines, robust data security policies, and integration of digital health into the national system have allowed it to scale these services effectively and safely. For countries like Kazakhstan, which are actively exploring ways to modernize their healthcare systems, Singapore's NEHR offers valuable lessons.
Вот у нас, допустим, есть программа Домумед, да, хорошая, вот. Но условно у нас не только одна программа Домумед, у нас есть несколько программ в Казахстане, но интеграция между ними очень, как бы, ну, она тяжела. Централизации нету, да, то есть он пролечился в другой клинике, или даже если, допустим, условно пациент лечится в частной клинике, есть ли или нет там Домумед, тоже непонятно. Но опять-таки эта информация, она должна упасть, закрепиться за этим пациентом, или по ИИН, либо по каким-то этим, она закрепилась, и все. Другой врач уже, когда открывает историю болезни, он видит, ага, у этого пациента были там такие-то диагнозы, и у него уже в голове, что он должен делать уже не только на основную патологию, а уже акцент брать на какие-то другие вещи, да?
Kazakhstan's ongoing efforts to digitize health services can benefit from Singapore's experience, particularly in the integration of technology and a patient-centered approach.
All the pieces are working together. It's just not a single item. So we do invest a lot in terms of public education. So before we roll anything out, there is a lot of communication. Just like yesterday we showed you the advertisement that we did. You just saw the TV advertisement. There's a lot of other outdoor advertisement, bus advertisement on the train, so that people are aware. So I think that is just one part of it. And then we send out SMS to notify people as well with a link for them to sign up, right? So in marketing, we call it like omni-channel. You go through different channels. Sometimes we have roadshows as well, right? So that over the weekend, people go to places that they gather, you'll see our booth being set up. And then this is a place that we try to get people to sign up. Yeah, so it is a mobilization of both digital and on-site activities to bring people on board. There are a few stages. One is, of course, to enroll, but once they're on, you kind of need to teach them what to do as well. So we have different campaigns at different stages.
Singapore has developed innovative care models such as hospital at home and virtual wards to address the needs of an aging population with chronic conditions. This comprehensive care approach reduces hospital congestion, lower costs, and improve patient satisfaction and outcomes. Kazakhstan has invested over 50 billion tenge in healthcare IT over the past 5 years. Yet, as Health Minister Akmaral Al-Nazarova admitted, the impact has been virtually zero. Over 35 fragmented systems operate without coordination, overwhelming doctors with paperwork and limiting patient care. The comprehensive medical information systems, meant to unify services, suffers from frequent crashes and poor integration with labs and registers. As MP Aygul Nurkina noted, this increases workload and frustration among the medical staff. President Kassym-Jomart Tokayev addressed the issue in 2024. Kazakhstan stands at a crossroads. To move forward, it must learn from successful models like Singapore, where digital health is seamless, efficient, and trusted by both patients and providers. Singapore's healthcare system is widely recognized for its efficiency, digital integration, and financial sustainability, while Kazakhstan operates in a very different environment characterized by large, sparsely populated territory, a democratic governance models, low trust in government institutions, and the pay-as-you-go pension system. There are still valuable lessons to be adapted.